I think one of the main messages that we are taking from this conference are some data on epidemiology, on cancer, especially on GI malignancies, and how much this is increasing. This is coming from one of the keynote lectures that we have during the first day, where we heard that 34% of the mortality of cancer is actually coming from GI malignancies, really highlighting how much more work we have to do to improve our patients' outcome. One of the very concerning data that we also heard that day is that there is an increasing incidence in the cancer in number of cases that we are going to have by 2050, which is estimated to increase by 77% across the globe. Our cancer cases are increasing, the mortality, as you see, is significant, and there is still a lot of work to do. We did have some discussions about prevention. We do know that a lot of the cancer cases are actually something preventable with smoking cessation, with reduction of the alcohol intake, also with a healthy diet, and also avoiding overweight. So that is something that everyone can do to improve the cancer incidence in the coming future. If we focus more on hepatobiliary malignancies, which are my area of expertise, one of the main studies that I will highlight is the TALENT-ACE clinical trial. This was presented during one of the plenary sessions, and it's an important study that is actually confirming the role of systemic therapy for patients with intermediate stages hepatocellular carcinoma. There was a very nice discussion around the data presented. This is the third clinical trial in this setting after another two studies, the Emerald 1 and the LEAP 012, that were previously presented in the past 2 years, showing the addition of systemic therapy to TACE in intermediate stage being superior to TACE alone. What we saw during the ESMO GI conference here in Barcelona is the data from a third clinical trial called TALENT-ACE. This is a Chinese clinical trial that we had that was recruiting patients to TACE versus TACE with atezolizumab and bevacizumab. And what we saw is that there was an improvement in PFS TACE and also PFS for patients in the experimental arm with a combination of systemic and the TACE treatment. The second highlight is how much data we have seen in quality of life. This is not only for hepatobiliary malignancies, but in GI in general. We saw 4 phase 3 clinical trials reporting data on quality of life. It is very important to make a reflection on this because it's really highlighting that the outcomes of the clinical trials are not only on overall survival, progression-free survival, or response rate, but that we actually have to understand the granularity of the impact of our patients are having from the treatment, especially in terms of quality of life. And here comes another reflection related to how we capture this quality of life data. Our current tools for capturing with questionnaires may not be the best, and we probably have to move forward with digital oncology, taking a larger place in this regard. In the area of biliary malignancies, the field is evolving very, very quickly. And I think what is most important is the fact that all the targeted therapies that we have been developing over the last years are now being moved forward into the patient's journey, moving into the first-line treatment, moving into the maintenance scenario, and also being combined with chemotherapy and immunotherapy. So the field is really at a very hot point at the moment, with new combinations and new strategies being employed for our patients in the coming future.